Down during this pandemic, you are not alone.
Yeah, a new study found 3 times more people say they are suffering from depression right now than before COVID-19. Here's KCAL 9's Nicole Comstock.
And among those people experiencing depression, experts say that unpaid caregivers like stay-at-home moms and essential workers are much more likely to be affected. Craig Yeton is working through a lot. Not only the financial hardship of trying to keep his San Dimas dive shop afloat during the pandemic,
helplessness,
but a fog of depression that followed it.
Feeling like I'm completely not in control of the things that I'm supposed to be in control of.
Though he may feel alone, he certainly isn't. A new survey published in the Journal of the American Medical Association says the number of Americans reporting symptoms of depression tripled this April during the first few weeks of the COVID-19 crisis compared to last April. 5 months later, some experts believe the problem may be much worse.
It's increased so much.
Psychiatrist David Puter says the Loma Linda University Behavioral Health Institute has seen a dramatic increase of people coming in with both depression and paranoia, likely triggered by staying at home alone.
And they're feeling that after months and months of doing that. They're feeling those sort of like, I've been on this island by myself. And it's really isolating. It's huge stress.
Dr. Puter says the best thing people can do is reach out to friends and loved ones.
Even if it's like, okay, once a week I'm going to call this list of people. And so get on the phone, just have those conversations, and get into nature.
He says if you're overwhelmed with negative thoughts, have major changes in appetite or sleep patterns, can't focus on or enjoy the things you used to, get professional help.
It's not easy to go and say, I need you to help me.
Yeton says he's not sure he will. Puter says he understands.
So I'm in mental health training and I have a difficulty reaching out.
Unfortunately, Dr. Puter says you might have to make 10 calls before you get in to see a psychiatrist because so many of them are just overwhelmed right now. He says you might have more luck getting into a day program. Reporting in Redlands, Nicole Comstock, KCAL 9 News.